Hi, I'm Guy Fragala, and I've been involved with safe patient handling and mobility for a long time. And what I'd like to do is give you a historical perspective of this movement. It's a relatively new movement, a new endeavor, but there is some history involved. Actually, if you do some patent searches, you can see that people were thinking about safe patient handling equipment over 100 years ago. We see some patents filed for patient movers, different types of lifts, but these patents were never pursued and products were really never developed. It wasn't until the 1950s when a person by the name of Ted Hoyer, who was inspired by a patent by R.R. Stratton for a mobile lift with expandable legs. This was when we really got the first piece of safe patient handling equipment that was commercially produced for sale. Ted Hoyer was a quadriplegic and he wanted more independence, so he took a look at this lift that Stratton had developed and modified it so that it could be used to lift people, and thus the term the Hoyer lift. And the technology really remained stagnant for close to 40 years because the Hoyer lift actually came out in the late 1950s, and it wasn't until the late 80s or early 90s till we saw some movement in this technology. There had been some devices developed, but nothing really took off until European technology began to come to the US. One of the first companies that began distributing equipment in the United States was Arjo. This was a Swedish company started by Arne Johansson. In the 1950s, he developed a technology company, not for safe patient handling equipment, but his wife had some needs. She had some dependency, some physical dependency, and he developed some equipment to help her. And he saw a need for this, and he began producing safe patient handling equipment and lifts and distributing it throughout Europe, and it began to take off. So his son brought this technology to the United States in the late 1980s and early 90s, and I actually was involved in helping Arjo get established in this country. We did a number of talks and presentations talking about the need for safe patient handling, and one of the things we did that was really important to the movement was it wasn't just the need for technology. We realized that we needed a program, a process to integrate this technology into the process of delivering care within our healthcare organizations. So I believe it was in 1993 we launched what was called the BIP program, the Back Injury Prevention Program, which was a program, a process that involved training, assessment, and all of the things we do today with our safe patient handling programs to complement the use of this equipment in healthcare institutions. Well, in addition to Arjo, there were other companies such as Leco, Goldman, who began bringing their products in and distributing these products. And the bed companies got involved also. The Hillroms, the Strykers, the Jerns, they saw a need to facilitate patient movement, to facilitate bed egress, and people began becoming conscious of this need to do safe patient handling because it was driven by the fact that caregivers were at risk for musculoskeletal injuries. And if you looked at injury statistics, there was a person by the name of Roger Jensen who worked for NIOSH when the 1980s began looking at injury statistics and realized that caregivers in healthcare were actually the most at-risk group for occupational musculoskeletal disorders. So he began doing some publications and writing about this. People took notice, and he, I believe, was motivated by some literature searches. There was some work done by Dalen in the 70s in the Scandinavian Journal of Rehabilitative Medicine that began to talk about the high incidence rates in Europe, and Jensen took this information and really began bringing some awareness in the United States. Now, at the same time, Dr. Bernice Owen, who was on the faculty at the University of Wisconsin School of Nursing, she became very concerned about what was going on with nurses and realized that for years we had tried to address this problem by teaching people how to lift in a biomechanically proper method. Well, as we began to look into the research that was done in this area, it was found that if you looked at the effectiveness of this training, there were some publications, there were a number of publications, and they stated consistently that teaching people how to lift properly actually had no impact in reducing the risk of musculoskeletal disorders to caregivers in healthcare. So this really wasn't the approach we needed to take. So Dr. Owen thought of the need for new ways to do this work. This was at the same time that some of this European lift technology began coming into this country, and she actually teamed up with Arun Garg, who was at the University of Wisconsin-Milwaukee campus, and he was an ergonomist engineer. And you may have heard of the Owen and Garg work. Well, they began doing studies looking at high-risk activities. They began assessing what the high-risk activities were. But very importantly, they established the need to change the way this work was done. They said, if we're going to have some impact at reducing musculoskeletal injuries, we need to change the way this work is done. We need to introduce some new technology into this work. Well, at this time, I was working at the University of Massachusetts Medical Center. I had started there in 1978. I was on the faculty, and I had responsibility for the health and safety of the workers. I was also the director of environmental health and safety. And I began looking at our injury reports and found that nurses were suffering injuries at a very high rate. And these injuries were due to moving and lifting patients. I began searching the literature and came across the work of Roger Jensen and the work of Owen and Garg. And we actually applied for a grant in the 1980s, and we did receive a grant and began developing a back injury prevention program where we introduced the concepts of ergonomics as part of the important route to improvement and reducing risk. Well, we pursued this, and at the same time, OSHA began thinking about what some of these risks were, and it was in the early 1990s when OSHA cited Beverly Enterprises in 5 facilities in Pennsylvania for exposing workers to unsafe working conditions because they had to manually lift and move patients. From this, OSHA determined a need to develop a standard, and it was actually in 1994 when they came out with an announcement of an announcement of a proposed rulemaking saying that we are going to pursue the development of an ergonomic standard, and part of the prime driver for this was the fact that caregivers in healthcare were exposed to these unsafe conditions that were causing a lot of injuries. Well, as a result of this this movement, we actually developed one of the first. It was actually the first safe patient handling conference. It was held in Sturbridge, Massachusetts. I believe it was in 1995, where we had 500 people come together to talk about safe patient handling. From there, other people began to become interested. OSHA continued their efforts. There were a lot of hearings going on in Washington where we were trying to prove that ergonomic interventions could be effective in reducing the risk of musculoskeletal disorders. And through searches in the literature, we were able to establish the necessary evidence that this was the case. Well, as a result of this, in 1999, at the end of the Clinton administration, there was actually an ergonomic standard issued by OSHA. Now, this was big news. This was a big deal for safe patient handling because this was going to require healthcare facilities to have safe patient handling programs. So this was great news for the industry. However, it didn't last. When the Bush administration came into power, the Congressional Review Act was used for the first time. The Congressional Review Act was an act that was established in 1996, and it said that we could actually review a legislation that had been passed and revoke it. Well, in either 2000 or 2001, the Congressional Review Act was used to revoke the ergonomic standard. Now, this was a big blow to the industry because as a result of this revoking of the standard, the Congressional Review Act went on further to say that you could not issue a similar standard in this area. So these were some dark days for safe patient handling. But the good news is at the same time, Audrey Nelson at the Patient Safety Center in Tampa began thinking about safe patient handling and mobility. And actually, Bernice Owen and I traveled down to the safety center quite often, had a number of meetings with Audrey, and we established the Patient Safety Center. And from these meetings, we did a small one-day program. I believe it was in 1999. It was really the first safe patient handling conference. And in 2000, the first National Safe Patient Handling Conference was established. And in 18 consecutive years from that date, we've done a Safe Patient Handling Conference every year. So we've begun this movement, we've begun this effort, and I just wanted to make people aware of some of this history because there have been some activities that had gone on, and a lot of people don't know about this. So hopefully this will be helpful to give you some background into what's gone on with safe patient handling in the past. Thank you.